Vigadrone 500 mg oral powder packet is used to treat babies, 1 month to 2 years old who have a condition known as infantile spasms. It has also been used in combination with other medications to treat seizure disorders, epilepsy. Vigadrone decreases the number of seizures in adults and children who have not been able to control their seizures with other treatment. It is an anticonvulsant that works by stopping the breakdown of a natural calming substance, GABA, in the brain. The recommended daily dosage and optimal timing for taking Vigadrone should be discussed with a healthcare professional. Before taking Vigadrone 500 mg oral powder packet, make sure to read the medication guide and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Mix the contents of the packet with water as directed and measure the dose using the supplied oral syringe. Take the dose right after mixing and do not mix in advance or store for future use. Discard any unused medication. Take this medication by mouth with or without food as directed by your doctor, usually twice a day. The dosage is based on your medical condition and response to treatment. For children, the dosage is also based on their weight. Your doctor may direct you to take a low dose at first, gradually increasing the dose to lower the chance of side effects. Follow your doctor's directions carefully. Take this medication regularly at the same times each day to get the most benefit from it. Do not increase your dose or take this medication more often than prescribed. Do not stop taking this medication without consulting your doctor. Your dose may need to be gradually decreased. For infantile spasms, tell the doctor if your infant's spasms worsen or have not improved within 2 to 4 weeks. For seizures, tell your doctor if your seizures worsen or have not improved within 3 months. Some common side effects of Vigadrone 500 mg oral powder packet include drowsiness, dizziness, difficulty concentrating, nausea, vomiting, stomach upset, diarrhea, headache, weight gain, and tiredness. Children may become restless or excited. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. If you experience any serious side effects such as shakiness, swelling ankles/feet, tingling/numbness, shortness of breath, fast heartbeat, or any unusual changes in your mood or behavior, contact your doctor right away. A serious allergic reaction to this drug is rare, but seek medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed here, contact your doctor or pharmacist. If you are in the U.S., call your doctor for medical advice about side effects or report them to FDA at 1-800-FDA-1088. In Canada, call your doctor for medical advice about side effects or report them to Health Canada at 1-866-234-2345. Serious vision problems may occur while taking Vigadrone 500 mg oral powder packet and may be permanent even after you stop taking the medication. To prevent vision problems from getting worse, your doctor must find any eye problems as early as possible. Also, tell your doctor if you have a history of vision problems. It is very important that you have an eye exam before or within 4 weeks of starting this medication, then every 3 months thereafter while you are taking this medication. You should also have an eye exam 3 to 6 months after stopping this medication. Follow your doctor's directions carefully and keep all medical/eye/lab appointments. Tell your doctor right away if you have any changes in vision, such as loss of vision, blurred vision, double vision, sensitivity to light, eye pain. To receive this medication in the United States, you must understand, agree to, and carefully follow the requirements of the Vigadrone REMS program. If you live in Canada or any other country, consult your doctor and pharmacist for your country's regulations. Before taking Vigadrone 500 mg oral powder packet, make sure to inform your doctor or pharmacist if you have any allergies or if you are allergic to any of its inactive ingredients. It's important to also discuss your medical history, especially if you have eye problems, mental/mood problems, kidney disease, or low red blood cell count. This medication may cause dizziness, drowsiness, or vision problems, and using alcohol or marijuana can intensify these effects. It's important to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do so safely. It's also advised to avoid alcoholic beverages and discuss marijuana use with your doctor. MRI tests have shown changes in the brains of infants given Vigadrone 500 mg oral powder packet, but it is not known if these changes are harmful. If your infant is going to have an MRI test, make sure to notify the testing personnel about their medication usage. Before undergoing surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be at greater risk for side effects such as confusion while using this medication, which can increase the risk of falling. If you are pregnant or planning to become pregnant, it is important to discuss this with your doctor. It's crucial to use reliable forms of birth control while using this medication, as it may harm an unborn baby. If you become pregnant, talk to your doctor about the risks and benefits of using this medication. Vigadrone 500 mg oral powder packet passes into breast milk in small amounts, so consult your doctor before breastfeeding while using this medication. It's important to be aware of potential interactions with other medications that could affect how Vigadrone 500 mg oral powder packet works or increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Do not make any changes to your medication dosage without consulting your doctor. Some products that may interact with Vigadrone 500 mg oral powder packet include drugs that can harm the eye, such as chloroquine, hydroxychloroquine, phenothiazines including thioridazine, and orlistat. If you are taking other products that cause drowsiness, such as alcohol, marijuana, cannabis, antihistamines, drugs for sleep or anxiety, muscle relaxants, or opioid pain relievers, be sure to inform your doctor or pharmacist. It's also important to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. If you have any questions about using these products safely, be sure to ask your pharmacist. Additionally, Vigadrone 500 mg oral powder packet may interfere with certain lab tests, potentially leading to false results. Make sure that lab personnel and all your doctors are aware that you are using this medication. If you or someone else has taken too much Vigadrone and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can contact a provincial poison control center. Symptoms of an overdose may include slow or shallow breathing, and loss of consciousness. It's important not to share Vigadrone 500 mg oral powder packet with others. While taking this medication, it's important to undergo lab and/or medical tests such as eye exams, kidney function, and complete blood count. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose. Take the next dose at the regular time. Do not take extra to make up for the missed dose. When storing Vigadrone 500 mg oral powder packet, make sure to keep it at room temperature away from light and moisture. Do not open the packets until you are ready to prepare the dose and avoid storing it in the bathroom. It's important to keep all medications out of reach of children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, ensure proper disposal when it is expired or no longer needed by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.